and WNST.net. As you know, all of our WNST coverage around here, especially when we're talking about injuries and some pain and how to get out of pain and how to get some help, whether it's concussion, whether it's anything sports medicine at all. The LifeBridge Health Sports Medicine folks at LifeBridge Health Sports Medicine Institute at Foundry Row in Owings Mills. I'm not wearing the hat today, Dr. Craig Bennett. How are you? I know we've been away for a couple of weeks. We've had combines and we had all this stuff going on, but the minute the Todd Gurley thing happened and arthritis happened in the middle of the combine and everyone's out there getting poked and prodded by folks like yourself and doing all sorts of medical tests, the Gurley thing's the weirdest thing because I don't hear of young people, young football players having arthritis, and I know you wanted to sort of stretch out and talk a lot about that this week.
Yeah, like many folks watching the Super Bowl, you wonder why he really was not that involved. And so you kind of figured that something was going on. And knowing his history of the ACL reconstruction in his knee, you kind of figured that there was something going on in that particular knee, and as it turns out, that appears to have been the case. So arthritis after an ACL injury is common, and it was much more common with previous ACL reconstruction techniques that we used. And I have not seen his MRI. I don't know him, but you got to imagine that he's got post ACL reconstruction, post ACL injury issues in regards to that knee.
I don't ever hear about arthritis after that. What you just said is it's common or something you need to worry about. We as sports fans, and again, I mean, you do this every day, and we do it 20 minutes a week trying to educate folks about stuff, but we hear ACL, MCL all the time. I mean, it's the most common thing we hear about as a fan, and just it feels a little bit like root canal. Like, they'll go away for a weekend or 3 weeks or 6 weeks or 8, whatever the diagnosis is, or 9 months or whatever, and they'll come back next season, and they'll be okay for the most part in the modern era. But we don't hear about the risks of all of that and arthritis on the backside, that it is more common maybe in the real world than we hear about it in the sports world.
Yeah, absolutely. So back in the 90s, one of the better studies in orthopedics was a study by a gentleman named Dale Daniels. And what he did is he looked at 10 years of ACL injured knees and ACL reconstructed knees and knees that did not have an ACL reconstruction. And prior to his study, when I was in my training, what we would tell people was that, well, you got to get your ACL reconstructed so that you don't get arthritis. And what Daniel's study, and again, it's important to understand that Daniel's study was looking at ACLs that were done 10 years prior to his study and during that time in the 90s. And the way we did ACL surgery back then is not as accurate as ACL surgery is now. But what his study found was that people got arthritis regardless of whether or not the ACL was reconstructed or not. People who had the ACL reconstruction, generally speaking, were more fit and could do more because they were more active and the knee did not give out and did not give them as much trouble, but they still got arthritis in the knee. So back after that study was done, the question was, well, wow, you know, what are we missing? Is it the injury itself that sets up a cascade of things and events in the knee that leads to the arthritis? Is it the way in which we're doing the ACL reconstruction? Is it cartilage injury at the time of the injury, at the time of the ACL tear as well? A lot of things that we've looked at over the course of the past few decades.
Well, am I wrong to say in the 90s this was more of like a scalpel and scar kind of surgery than in the modern era where it's a little more laser? And I mean, you're the doctor, you tell me, but I would think that you would probably have an uglier issue 20, 25 years ago in every way because it was much more invasive then, was it not?
Well, yes and no. So the biggest difference from an ACL surgery standpoint was how tight we made the graft. The graft is the tissue, the tendon that we put into the knee to make a new ACL. And so back in the 90s and in the 80s, the thought was make it as tight as you can so that this knee does not have any extra play to it. And the other difference, one of the big differences, is the position where we put the graft. And so we put the graft in a position that, again, made the ACL super tight in terms of moving front to side. But the ACL also controls the rotation or the spin in the knee. And so over the past few decades, we've learned that the spin is actually more important than the front-to-back tightness. So a lot of the ACL reconstructions in the 90s were still done arthroscopically. It's that the way we put the graft in, the tension, and the thought process was a little different than it is now.
So is the procedure more than the actual... Dr. Craig Bennett is here, LifeBridge Health Sports Medicine Institute. They're in Foundry Row up in Owings Mills. You hear the Cal Ripken commercials here. You know all the things they can do. But we're trying to educate folks. And on the sports media side of this, for me, there's one thing about arthritis and Todd Gurley. Doc, you know I had chondromalacia. I had a technique done to me, I guess, 13 years ago. It was the summer of 2006. I probably should ask you this. Am I more susceptible to arthritis as a 50-year-old guy walking around, running around? Would there be something that I should be worried about, or anybody else that's had these sorts of things that maybe go see their doctor or come see you and say, hey, I need to maybe adjust what I'm doing, maybe train a different way so that can arthritis be avoided, I guess is what I'm asking you as a guy who's a little worried about this now.
So short answer is yes. Well, let's go back. Let's talk about definitions. So what is arthritis? So what we're talking about is loss of the articular cartilage in the joint, that white, shiny cartilage that lets the joint slide smoothly. And a joint is a connection between two bones. And when you've got damage to a joint, whatever the joint is, and if that joint damage involves the cartilage in the joint, then by definition, you are going to be at increased risk for arthritis. So, just generally speaking, if you've had injury to a joint, then for the most part, there is going to be some increased risk. Now, it depends upon where the joint was injured, but the short answer is yes. Particularly as a 50-year-old, if you've had a joint injury, you do want that evaluated. You do want to get an x-ray of that joint. If you're having pain, swelling, decrease in your range of motion, those are kind of the things that you're going to look for to know that even if you're not that old, and your 40s or your 50s or even your 30s, and obviously in Gurley's case in his 20s, that's something that needs to be worked up and evaluated.
Here's Dr. Craig Bennett. You can find all that they do out at Foundry Row at LifeBridge Health Sports Medicine Institute. He joins us every other week. He does the orthopedic side of all of this stuff. And, of course, Dr. Kevin Crutchfield does the concussion side. We have interesting and fun chats with them on a weekly basis. We do appreciate their sponsorship. If you are a weekend warrior, you need the pros to treat you, come on out and see our friends at LifeBridge Health Sports Medicine Institute. My wife's going to be out to see you with her shoulder issues right now. But I want to go back to arthritis and just understanding one more thing about it, I guess, to say, is there anything that can be done to avoid it, right? I mean, is that what the training and the strengthening and the reason folks would come in twice a week to strengthen a muscle, is that the way to avoid it, or is it something that can't be avoided?
Well, it's multifactorial. You talk about injury. So if you have an injury, you need to, as you were just commenting on, you need to do everything you can to recover from that injury before you go out and stress that joint once again. And then the stresses that you put on the joint are going to be dependent upon what the injury was, whether or not it was a ligament or a tendon or muscle or the cartilage, and whether or not you've completely recovered before you go back and stress the joint again. So the thing that is, generally speaking, for a knee in particular, the worrisome activity is impact activity, like jumping or running. So if you've got significant injury or even minor injury to your articular cartilage, it should be quite a while, as in potentially 9 months to a year, before you go back and impact, run and jump on that cartilage. And if the cartilage is not completely recovered, then you may need to have something done to address it. And if the cartilage is significantly damaged, you're probably better served not doing impact activities. You should swim, lift weights, ride a bike.
Do yoga.
Do yoga. And stay away from things that are going to continually pound and load on that cartilage that, even though it's recovered, is normal.
Here's Dr. Craig Bennett. He's at LifeBridge Health Sports Medicine Institute. Doc, you'll be happy to know we're 10 minutes into the conversation, and I haven't even mentioned my elbow yet. You've fixed me up. I'm wearing my stand-to-man Stasiak thing that you've got me here, whatever you call this brace. It really is amazing because a time and some techniques, it really does heal. It takes a little time if you're in pain and no one has patience for it and they all want a pill and make it go away in a day. But you've given me a device, literally, and some topical, and you've really eased a lot of my pain. So sometimes it doesn't have to be a needle or be invasive. They can come out and see you and not be too afraid of what you might do to them. How about that?
Great. Well, I'm glad you're doing well.
Appreciate you. Dr. Craig Bennett, LifeBridge Health Sports Medicine Institute out of Foundry Row in Owings Mills. They are the new game plan for all things sports-related injury, backed by the surgeons and the doctors, just like Dr. Craig Bennett and Dr. Kevin Crutchfield, who will be here next week. We appreciate them. And if you see Cal Ripken on the billboards, honk the horn. You'll hear him here on WNST as well. Cal working as well with LifeBridge Health Sports Medicine Institute at Foundry Row in Owings Mills. You can find me out on the buyatoyota.com audio vault 24 hours a day from anywhere in the world on your mobile device by downloading the TuneIn radio app. We come in crystal clear from anywhere in the world. The morning newspaper ships digitally to your email inbox each and every morning at 7 a.m. That's all powered up by Planet Fitness and PlanetFitness.com. Apologies to everybody this week that got the wrong paper. We had a little software snafu issue. We're working to get that rectified. Also, Saturday, 1 p.m., UMBC hosting Albany in the playoff game. Got quarterfinals going on, semis next week, finals. Who knows who wins? That's part of the fun of the America East tournament that, you win, you keep playing, you may get a home game. Who knows? So get on out to the UMBC Event Center on Saturday. If you haven't been to the new gym there, it's more like an arena. It's not a gym anymore. The Rack was a gym. This is an arena. Get on out to Catonsville. Support them on Saturday. I am Nestor. We are WNST.net, AM 1570 and WNST Tassel, Baltimore, and we never stop talking Baltimore sports.